Serving all of San Diego, this is your Fox 5 News.
A scary on-air moment for a news reporter. You've probably seen it by now. It went viral literally in seconds. But it had a lot of people wondering what went wrong. Fox 5's Christina Lee explains what was going on medically.
We had a very Darrison, but let's go to Terrace.
As soon as I opened my mouth, I knew something was wrong.
On the KCBS morning show, reporter Serene Branson talks about her unsettling on-air episode at the Grammys. Before her live hit,
And I was starting to look at some of my notes. I started to think the words on the page are blurry. And I could notice that my thoughts were not forming the way they normally do.
Well, a very heavy divertation tonight.
Doctors at UCLA say Branson didn't suffer a stroke, but a migraine aura, a condition that runs in her family.
It certainly was very dramatic, but that's very consistent with migraine aura as a cause of it.
So what exactly is it? We sat down with neurologist Dr. Jack Schim with Scripps Memorial Hospital in Encinitas to find out.
Well, migraine is, of course, a very common headache condition. The aura used to be thought to be a blood flow related issue, stroke-like, and we now know that it's actually a change in the electrical activity of the brain.
Most often genetic, this condition usually develops before the age of 40. Of those who get migraines, only about 15% get these types of migraines. Dr. Schim says typically the aura precedes the migraine, which is what Branson was experiencing.
Well, the aura aspect usually lasts less than an hour, usually. Migraine pain, the whole attack, typically lasts half a day to several days.
Dr. Schmin says this complex migraine affects women more than men.
Certainly hormonal being the most obvious, but there's actually thoughts that there may be genetic reasons beyond the hormonal fluctuations.
Thankfully, Branson will not have lasting neurological damage. However, research shows migraine sufferers are more likely to have a stroke. Now, if you suffer from migraines, doctors say the best thing to do is manage them, and you can do that by good diet and exercise, getting enough sleep, and also managing your stress level. Kathleen?
So did the doctor say what someone should do if they were experiencing these kinds of symptoms?
Absolutely. They say get to the hospital. They first want to diagnose you, then they can go from there.
All right, good to know. Thank you for clearing it up. Christina Lee tonight.